Sir,
Sure. So I'll go for it.
Urman sir, I'll just provide the background of the article, so you can go ahead with your comments. You can directly go ahead with comments. So the article is from recently published Diabetologia 2021 of June, and it's the article title is Impact of High Glucose Level and Glucose Lowering on Risk of Ischemic Stroke, a Mendelian Randomization study and with meta-analysis, and that has been provided to all of us. The article abstract is openly available, and as it is close, I'll say the subscribe article, we would be able to show only the abstract over here. Yes, sir. You can go ahead with the comments.
Yeah. So the article very nicely suggested that whatever guidelines are available globally for diabetes, they look for chronic kidney disease and change the treatment accordingly. They look for atherosclerotic vascular disease, change the treatment accordingly. They look for even heart failure and change the treatment accordingly. But none of the guidelines have included stroke risk. And this article raises that alarm that we should also now start thinking about stroke risk and change the treatment accordingly. I'll not go into the details of the article, but overall, it says what we knew for years. When we had a DREAM trial, we knew that pioglitazone has a definitely beneficial effect on reducing the ischemic stroke in diabetics. So the study has come out that it is time for us to have a stroke risk calculator to be included in guidelines, global guidelines, and accordingly to make the changes. And two important drugs that have been suggested, which definitely reduces the ischemic stroke risk. One is obviously pioglitazone, which reduces the stroke risk, and the number two is GLP-1 receptor agonist. They also reduce the stroke risk. So whenever you feel that the patient has high stroke risk, it is always better to include one of these two drugs or both of them, pioglitazone or GLP-1 receptor agonist or both, in your treatment armamentarium, because multiple trials have now proven that they reduce the ischemic stroke. So time for us to change the guideline, look for, just like we have got ASCVD risk calculator, which of course includes stroke, but have a separate stroke calculator, stroke risk calculator. And if that stroke risk calculator suggests that patient is at a high risk of developing ischemic stroke and is diabetic, type 2 diabetic, then it is time for us to include pioglitazone and GLP-1 receptor agonist if there are no contraindication. So this once again opens up a new way of adjusting the guidelines. And I'm pretty sure in a couple of years, pioglitazone would be heading the stroke risk patients in the guidelines, provided there are no complications.
Thank you, Dr. Urman sir. Yeah. Over to Vishal bhai and
thank you, sir, for giving us a comment. We are trying to, Swasthya is trying to prepare this video library for all research articles. It will be shared in our Swasthya newsletter to all our faculties and participants at the end of by this month. It includes a presentation and comments by experts also. I am giving, I invite Dr. Mahapatra sir for further comments and thanks.
I have a question to Dr. Urman. Have you used this pioglitazone in ischemic stroke? And if yes, then what is the dose required or what is the advisable dose?
Yeah, looking to the DREAM trial, we tried it for 6 months in 2018 and up to December. In fact, myself and Manoj put 25 patients on them, and they all have been followed up with excellent results. We used only 15 milligrams, 7.5 milligram to start with if the weight gain was not there, with good 2D echo, and postmenopausal females were excluded. None of them have developed ischemic stroke for 2 years, but once the COVID came, the use of pioglitazone went down. But yes, we have tried, and I'd completely forgotten that idea. But this article induced me to go on again with that trial, and that's where I would thank Swasthya, because really it is putting ideas into our minds and helps a lot.
Thank you very much, Dr. Urman. you are always with us. You are always with the advancement or the academic sessions. There are useful to people working in the field of diabetes. I thank all the young team. I'm proud to say that the young team has taken all the responsibility of organizing and managing the show. So there are 12 or more people that are working and continuously working, because next week is again newsletter and then again planning for next MDR. That is on the 3rd week. So I thank all of them. I thank especially KOL like Dr. Urman Dhruv, Dr. Madhav Desai, Dr. Prasanna Kumar, and many more. Though they have a very busy practice, very busy days in this particular period of Corona, they are always with us and they are making this show successful. I thank you very much for all the participants too. Thank you all.
And all faculties who have made the tremendous efforts to make those presentation and go through articles and prepare for the drilling from the comments. And we really appreciate all the faculties. And that keeps us to the theme that we are brisk and crisp on time and completing in this 1 hour to 1.5 hours. And with all of your efforts, this is possible. To all our dignitaries, faculties and guests and mentors and experts, thank you, and looking forward to further meetings. We would send you the invites for the same and the links of your talks as well as the newsletter. Yes, Urman sir, last comment from you.
No, but this is really very, very helpful. Actually, Dr. Mayur said that I am helpful to you. No, you are helpful to us because it induces us to learn more and more. And nobody can be a teacher in diabetes. Everybody has to be a student. The moment you fail to be a student, you are out. So you induce us to be a student. We go on learning new things. Just like today, I realized that blood pressure and lipids are being ignored even in few of our patients, and although they are easy to monitor. So it's a learning thing, and we are thankful for you.
To all of us, have a nice day. Festivals are ahead. Take care. And Corona is still there. So be proactive and take care of yourself.
And don't forget to join for the meeting. That is an international conference on NGO being held on 12th, 13th, and 14th August. Encourage your colleagues to participate. Encourage your colleagues to, if they have innovations, they can submit. Still, we can take it. Even encourage your people activity if they have some good activities, which is maybe can nominate for the award. There are 7 categories of award. So I request all of you to pass on this information to your colleagues and friends across the globe. Even outside India, people are participating in this conference.
Sure, sir. Thank you, sir, so much for your wonderful presentations. I'm dietitian Nehal, and really liked that you shared the link with me to have this opportunity to attend it. Thank you, sir.
Thank you, Nehal madam, for sharing your testimonies for the same.
Yes.
Thank you very much, sir.
Thank you.
Well done.
Thank you, Disang bhai. Nice presentation.
Thank you.
Sir.
Nimi, Disang, Nishal.
Thank you so much.
Thank you.
Thank you. Have a good day. Bye bye.
Thank
you all for
Thank
joining.
you all.
Thank you. Thank you. Bye.